We're going to now hear about the basics of grant administration from our partners at the Health Resources and Services Administration. So welcome to Shonda Gosnell, Gwendolyn Hirsch, and Marian Montez, all of whom work in grants management in the agency. We're really looking forward to having you tell us the basics and set the folks up in the network for success. So Shonda, I'll turn it to you.
Actually, thanks, Marcia. This is Gwen. I'm going to kick us off.
Okay, good.
Great. You can go to the next slide, please. As Marcia said, we're from Health Resources and Services Administration, and we're really excited to spend the afternoon with you and present some basics of grants administration. Next slide. Before we get started, I'll just briefly introduce myself. My name is Gwen Hirsch, and I'm with the Division of Grants Policy as a Grants Policy Analyst. I'm here with two of my HRSA colleagues, Shonda Gosnell, who is also in the Division of Grants Policy right now, but has 20 years experience in the Division of Grants Management Operations and brings a wealth of information with her on grants management. Also here from HRSA is Marian Montez. Marian works in the Division of Financial Integrity and will provide some information about documenting, evaluating, and reporting on federal grants. So before we get started, I'm going to turn it over to Shonda just to get some information from you all. Next slide.
Thanks so much, Gwen, and good afternoon, everyone. As Gwen mentioned, my name is Shonda. I'd like to begin by making sure that everyone is familiar with the Zoom features, which we'll be using during our session. You probably are, because I know you guys have been doing this for a couple of days now, but just to be sure, if you look at the bottom of your page, you'll see a few features like I said, you're probably familiar with, but just in case, these are the ones we'll be using. One is the chat feature. So if at any time during our presentation you have a question, feel free to add it into the chat. And at the end of our presentation, we will use the Q&A time that we have remaining to go through the questions and respond to as many as possible. If there are any questions we're unable to get to, we will send you responses back after the session so that they may be added into the general Hoover response section. Next, we'll be using the polling feature. So when you see a poll pop up during our presentation, please use that to submit your responses and select your answers. Finally, if at any time you find that you need us to speak faster or slower, or you would like to give us a thumbs up, a clap, or even a heart to let us know you agree or love something we've said, you have those options to select as well. So I know that we are the last session on the last day, and you may possibly be feeling a little bit of conference fatigue, but we promise to do our best to keep things interesting and fun. So let's start with a couple of polls so that we can get to know you a little bit better. Josh, could you please put up our first poll? So who here has ever applied for a federal grant? And I did get to hear some of those some of that conversation from that last session, so it sounded like we did get a little bit of that response there. Okay, great, Josh. If we could see those results now. So it looks like the majority of you actually have applied for a federal grant before. So some of what we're going to go over today, as Dr. Brand mentioned, are going to be the basics, but it may be a refresher for you. And then for those of you that haven't, which still looks to be about half of our group, we hope to give you some great information. So poll number 2, please. How many of you represent the programmatic side of your organization, and how many of you represent the fiscal side? Wow, okay, great. Okay, we do have some fiscal folks coming in, great. Okay, we can go ahead and show the results to the group now. So it looks like most of you would classify yourselves as programmatic, although we did see a few fiscal folks chime in there as well. we would like to suggest that if your counterpart, so if you're programmatic than the fiscal counterpart or vice versa, from your organization isn't also in attendance with you today, that you be sure to share the valuable information that you learn with them so that they too know what to expect. And poll number 3, please, Josh. Okay, so this has 2 questions in it. For those who have applied for funding before, how many of you actually received a federal grant or have worked on a grant program? And then the second question there, who would like to? So let's try to find out what you are hoping to get out of this session. Are you intrigued by the idea of receiving a federal grant, but just trying to learn a little more? Do you already know some things about federal grants, but you're trying to determine if it may be helpful for your organization to apply? Do you already know that your organization wants to apply, but you're seeking more information before you do so? Or are you just here because it's the last session of day 3 and you're expected to be here? Got people still chiming in. Okay, great. You can show those results now, Josh. All right, very good. So looks like still the same about it. That first question, responses about half and half. And most of you are looking to get some more information. We did have some very honest folks there on that last question saying that they're just here because they're expected to be here, which is funny. Thought I'd add in a little bit of humor for that question. So looks like we have a mixed group of knowledge with a lot of interest. So I just want to say thank you so much for your engagement and responses in those questions. And now that we know a little bit more about each other and what we'd like to accomplish, let's see what we can do to help make that happen. I'll turn it back over to Gwen.
Thanks, Shonda, and thanks for everyone for taking a minute to respond. Your responses are going to help guide our conversation today. I know we have a wide range of reasons why you might be with us today, so I think that everybody will get something out of our agenda. Today, we're going to cover a few important items. First, we're going to review some of HRSA's background and our infrastructure and some other important information about our agency. We're going to show you what you need to do to prepare for a federal application. We'll walk through some parts of the application process and the Nofo, the Notice of Funding Opportunity. We'll also identify what makes a strong application and some common mistakes that you'll want to avoid. We'll show you a sample of a Notice of Grant Award or an NOA, and we'll go over some expectations after the award is made. Finally, we'll close out today by talking about documenting, evaluating, and reporting, and try to ensure that your organization is ready for any site visit and/or audit. Next slide, please. Great. So let's start by talking a bit about HRSA. HRSA stands for Health Resources and Services Administration, but you'll hear us use HRSA pretty exclusively throughout the presentation. Our vision at HRSA is healthy communities, healthy people. To achieve that vision, our mission is improving health outcomes and addressing health disparities. We do that through access to quality services, a skilled health workforce, and innovative high-value programs. We achieve this mission by providing grants and cooperative agreements to over 3,000 awardees. Some of our awardees include faith-based organizations, colleges and universities, hospitals, state, local, tribal governments, as well as private and nonprofit entities. Next slide. Great. HRSA has a $12.1 billion budget for fiscal year 21. And this budget supports more than 90 programs that provide healthcare to people who are geographically isolated and those who are economically or medically vulnerable. This includes people with HIV and AIDS, pregnant women, mothers and their families, and those who are otherwise unable to access high quality healthcare. HRSA also supports access to healthcare in rural areas, the training of health professionals, the distribution of providers to areas where they're needed most, and improvements in healthcare delivery. In addition to all that, we also oversee organ, bone marrow, cord blood donation and transplantation. HRSA compensates individuals harmed by vaccination, and we maintain databases that flag providers with a record of healthcare malpractice, waste, fraud, or abuse. In addition to our core funding, HRSA has awarded more than $2.5 billion through grants and other funding mechanisms in response to the COVID-19 pandemic. Some of these include expanding capacity to diagnose and treat COVID-19, increasing access to telehealth and supporting telehealth services, as well as training for our healthcare providers. Since April, we've managed the distribution of the $178 billion Provider Relief Fund to eligible healthcare providers for healthcare expenses or lost revenue attributable to COVID-19. An additional $2 billion is also available to reimburse COVID-19 testing of individuals without healthcare coverage. All told, nearly 30 million people nationwide receive primary medical, dental, and/or behavioral health care from HRSA, from a HRSA-funded health center. Next slide. HRSA is one of 11 operating divisions under the Department of Health and Human Services, HHS. Some of the others include the CDC, CMS, which is the Center for Medicare and Medicaid Services, Administration for Community Living, SAMHSA, which is the Substance Abuse and Mental Health Services Foundation, the FDA, NIH, which is the National Institutes for Health, and then there are other offices such as the Center for Faith-Based and Neighborhood Partnerships, Office of Civil Rights, and our headquarters is located in Rockville, Maryland. The map that's on your screen now shows the additional 10 HRSA regional offices, which also align with the HHS regional offices. So while there may not be a regional office physically located in your state, you can see from the slide that each of the color blocks include coverage for all the states in that region. Our colleague Marion is joining us today from Region 9 in San Francisco. So now that we know a bit about where we're located, let's move on to HRSA's funding. Next slide. This slide simply shows a breakdown of our enacted $12.1 billion HRSA budget for fiscal year 21. So as you can see, this is the amount provided across the United States for all of our focus areas, the largest of which goes to primary health care. Next slide. Great. In this presentation today, we're just going to provide a high-level overview of how the federal grants process works. The process begins with planning and before an announcement is made, and applicants may then submit an application for the announcement of interest, which is evaluated and negotiated prior to an award being made. Once awarded, the post-award monitoring continues until the project is complete and the grant is closed. So for today's presentation, we're going to stay high level on all parts of the grant's life cycle, but we're going to focus primarily on the announcement through application phase of the grant life cycle. Next slide. So now that you have a very brief background on HRSA and some of our funding streams, we're going to help narrow the lens. Maybe you've already started thinking about a program or an initiative that you're currently working on, or something that you plan to work on, and ask yourself, how do I apply for one of HRSA's grants? So today, hopefully by the time we're done, we'll have answered many of your questions. And if not, we'll take some time after to answer those. So let's get into some of the Grants 101 information. Next slide. The types of grants available by federal entities is very broad and includes grants for cities and states, as well as community organizations and foundations. Every grant has a different requirement, but you're sure to find one that intends to provide funds for programs that you're interested through. So we'll walk through the federal grants process, the very first step of which is to register and get ready. This is a very important chart. If you think that you're going to apply for a federal grant, especially if you're going to apply for a grant with any of the HHS entities, the first thing that you're going to need to do is register with a few systems. So as you can see on this chart, we've highlighted 3 important systems and sites. And before I go into detailed information about each site, I just want to get a better idea about where your organization might be in the registration process. So could you please pull up poll number 4, Josh? Thanks. If you can take a minute and just quickly respond to the poll on your screen. My organization has registered with DUNS, SAM.gov, grants.gov, all of the above, or none. Please select all that apply. Great, looks like we still have a few more people voting. Okay. You can go ahead and share those results. It looks like we have a pretty even mix. We've got some people registered with DUNS and SAM.gov. About 30% of you have registered with all of them, and another 30 have not started this registration process, which is completely okay. I'm going to leave this chart up for a few minutes. So as we're talking through the details, please feel free to copy down some information. Shonda has shared these links in the chat box so that you'll have direct links. You'll also be able to find all these links in the Whova agenda after today's session. So a lot of you said that you already have a DUNS number, which is great. If you haven't, then that's going to be your first step. The DUNS system just identifies your organization and allows for the tracking of funds. Each year, HRSA receives about 3,000 to 6,000 submissions a year, but you'd be surprised at how many never even make it to HRSA. The primary reason for applications being rejected for errors in grants.gov is missing the deadline or for submitting an application with the incorrect DUNS number. So even if you do have a DUNS number already, you just want to double check to make sure that you're using the appropriate DUNS number when you apply. After you've obtained your DUNS number, you'll want to make sure that your organization is registered with SAM.gov. SAM.gov is the System for Award Management, which helps identify the people in your organization that are authorized to conduct different transactions in the SAM.gov system, such as submitting an application for a grant. It also identifies various points of contact, such as the AOR, which is the Authorized Organizational Representative. Only AORs are authorized to submit applications for your organization, and SAM.gov registration must be updated annually. If your registration or the registration of one of your important points of contact expires, you will not be able to submit an application until it's renewed. So even those that have already registered for SAM.gov, you need to go in annually and make sure that that registration is up to date and current. Because these are so important, HRSA includes a statement on the cover of every one of our Nofos that reads, "Ensure your SAM.gov and grants.gov registrations and passwords are current immediately. HRSA will not approve deadline extensions for lack of registration. Registration in all systems, including SAM.gov and grants.gov, may take up to 1 month to complete." So if your previous SAM representative or eBiz point of contact has left and you have a new representative, the record needs to be updated with the new contact in the system as soon as possible. You want to make sure that people are properly registered and that they receive all the relevant emails. So now that you have a DUNS number and you're registered in the SAM system, you're ready to search for and apply for grant funding in grants.gov. Grant applications are all submitted via grants.gov, and the information from the DUNS system and the SAM system are used to complete that profile in grants.gov. So the authorized organizational representative, the AOR, must update his or her grants.gov registration annually, and passwords must be updated every 90 days. So the first thing you need to check before you start looking for grants to apply for is that your grants.gov registration is valid and your passwords are updated. We just want to make a note that the updates take about 2 to 3 business days to transfer to grants.gov. So they must occur before, at least a couple days before your application can be validated in the system. The eBiz point of contact, which is set up in sam.gov, approves the authorized organizational representative who are responsible for submitting the application on behalf of your organization. Just a quick note, you don't have to pay to register with any of these systems. The registration is free, and all of the websites that you need to pay attention to are listed on this slide. But we would like to draw special attention to the part of the timeline that says up to 4 weeks. These systems may take at least 4 weeks to register in all of the systems. So if you are in that group that hasn't registered yet, or maybe you've only registered with the DUNS number, we recommend that you register for these systems as soon as possible. All of these are done electronically. So make sure that you monitor your emails and that you respond and update information when it's requested. It's really an important step in the process. The last thing that we want is for you to have a great grant application and it's rejected and never makes it to HRSA because one of your contacts wasn't updated in the system. So now that we've gone over a ton of information, we just want to check to make sure that we're all on the same page. So if you could please pull up poll number 5 and we'll just do a quick knowledge check before we move on. So the question is, if I'm going to apply for a federal grant, my organization must be registered with DUNS, sam.gov, grants.gov, all of the above, or none. So I'll just take a minute and let people respond. There's also a lot of tutorials on how to register and sign up. So if it seems overwhelming now, each site has some tutorials to help you through the process. Great. It looks like about half of the participants have responded, so I'll give it another second or two. Great, you can share those results. So it looks like 76% said all of the above, which is the correct answer. All right, so now that you've responded and you are registered and ready to go, you can move on to the next stage in the process, which is finding the money, which is always the fun part. So let's just take a minute to look at and go over some information for where to find federal funds. Grants.gov is going to be where you're going to find information on all federal grants. We'll talk about it a lot today. And anybody that's visited grants.gov before or is familiar with the site knows that it can be a bit of a, going down a bit of a rabbit hole. But I can't say enough about how helpful and informative the website really is. As somebody that started their career in fundraising for a nonprofit, I used this site frequently, and I have to say it was one of my favorite tools. So just want to go over a couple minutes of how to find and navigate the site. So first thing you want to do is hit search, search grants, and you can see that circled in red right at the top. Next slide. Great. We've added some screenshots, but as you have some time to go through the site, you'll get a lot faster and more efficient in finding the information that you want and need. So for this presentation, circled in red, I've added HRSA as the keyword. You can choose to type in another agency. You can also use a topic of interest such as oral health, or you can simply use the filters on the side. Maybe you want to filter for a specific grant or a specific federal entity that is not under HHS. All the grants will be listed here, as you can see on the right-hand side. You'll see all of HRSA's grants. Also, to draw a little bit of attention to the blue circle, we've highlighted forecasted and posted grants. A forecasted grant is just a grant that it's not currently available or accepting application, but is projected to become available in the future. So this is important because it gives you some extra time to help plan and prepare. and really see what type of funding opportunities are going to be available in the near future. It also gives you time to think about what programs you might want to do in the future if you know that there's going to be funding available. Posted just means that the Notice of Funding Opportunity, or NOFO, is open and accepting applications. Next slide. Great. So once you select a grant from the list, and sometimes you'll see hundreds and hundreds of them, but once you find the grant that you want to view, you can select that grant and it'll pull up some quick information, such as the type of grant, the amount of funds available, the eligibility, as well as important dates such as the due date. As you can see for this one, we did a quick search before our presentation, and this is one of HRSA's currently open grant programs. It's the Dental Faculty Loan Repayment Program. And I'll draw your attention to the closing date of April 19th. So there is still time if that interests you. To get some more information about this specific grant, you would want to select Package, which is the last blue tab. Once you select the Package tab, you can then preview and print the PDF of the full grant package. Next slide. The next screenshot is just a screenshot of a current grant opportunity package for oral health. This one is available from the National Institutes of Health, improving oral health and reducing disparities in adolescence. Again, if you're interested, you can use those exacts. You can write down the grant number, which is listed right at the top. Next slide. If you're interested in applying for federal funds, or even if you might want to apply for federal funds in the future, we really suggest that you subscribe. I heard some conversation about subscribing before we started our session. So you can subscribe as an individual or an organization, and you can select options to manage your subscriptions. This way, you receive updates on any grants or projected forecasted grants in your based on your keywords or your topics of interest. You can also subscribe to specific agencies to get alerted as soon as they post a new grant or forecast a new grant. There's also a number of tutorials of how to manage your subscriptions and to make those a bit more specific. Next slide. So if while you're on grants.gov and you don't find the information that you need, we've included this slide just to give you some information about how to find support on the site. So you can search their portal for tutorials. You can also call somebody to request support or put in an email request. They also have a web chat. So there's really a lot of options and support out there to help you find what you need on the website. Next slide. In addition to registering and subscribing to grants.gov, we really encourage you to visit the HRSA website, which is www.hrsa.gov/grants. Agency websites are a really good source to find funding opportunities or grants that are available or becoming available that suit your interests. In addition, the grants.gov website is also listed here. But we recommend that you sign up for email notifications for both HRSA and grants.gov. Next slide. So now that you've seen where to find the funding and how to search for it, we just want to go over some information about the notices of funding opportunities. You'll hear us refer to these as NOFOs. You may also have heard them referred to as funding opportunity announcements, or FOA. No matter what the agency refers to them as, all federal announcements have to follow the same format, which is set by OMB. So here's an example of HRSA's NOFO cover page. Again, this is the Dental Faculty Loan Repayment Program that is still open. The NOFO, or Notice of Funding Opportunity, explains the purpose of available funding. It includes all the eligibility information, program history, regulations, review criteria, contact information, It includes everything an applicant would need to know to apply for funding, including the due dates and any other important dates for technical assistance. Next slide. So before you consider applying to a grant program or a Nofo, we really encourage you to read the Nofo cover to cover and to pay attention to key requirements and determine if you should apply for that opportunity. So we'll just talk a bit about the Nofo Basics. First, you have an executive summary, which is typically about a page. This includes key Nofo requirements, the announcement number, the all-important due dates, and any other important pieces of funding information. The second section is the award information. This section covers the type of award, the summary of funding. The type of award is simply whether it's a new award, a competing continuation, or a competing supplement, and whether it's a grant or it's a cooperative agreement. The summary of funding explains the total amount of funding available, the anticipated number of awards, the periods of performance, and any limits to that funding. Be sure not to apply for more than the listed ceiling amount. Section 3 contains the eligibility information. This section contains information about eligible applicants, as well as cost sharing or other important information. Eligible applicants can be dictated by statute, legislation, or regulation, as well as cost sharing or matching information, if it's statutory or regulatory, will also be included in these sections. Other eligibility requirements may also include whether there's maintenance of effort or there's a limit on the number of applicants one entity can submit, as well as any eligibility criteria for your beneficiaries or program participants. And then finally, when you review that application due date, you should really ask yourself, can I meet that deadline? When you're factoring in, parts of the Nofo, if there is an intergovernmental review required, do you need any partnership agreements in place? And does it require state matching? And do you have time to secure that match or to go through that review? Next slide, great. This slide simply outlines the contents for each section of the Nofo. It's just an easy reference when you're trying to locate a particular section. Next slide. So I'll take a couple of minutes to discuss some key sections in the Nofo. First, we'll start with section 4, which is the application and submission information section. I want to highlight that the guide provided in this section of the Nofo tells you exactly what you need to respond to and the associated review criteria for those. To further clarify, it includes what the agency or program wants to see in the narrative, as well as how the application is going to be scored during the review process. Keeping in mind that our reviewers are using the same exact information during their review. Next slide. As I mentioned before, let's talk a bit about the application review section. It's obviously an important part of the process, but the Nofo is going to tell you exactly how the application will be reviewed. As you can see from this example, it provides information regarding the number of points for each section and the criteria that reviewers will be using. Also included in the section would be any funding preferences or priorities that have been identified. That will also be included in this section. Next slide. Another section to highlight is the award administration and agency contacts section. Section 6, which is the award administration information, provides information on when you would receive your notice of award and just states that if you're successful, the award and any activities that are under your award would be subject to all the provisions outlined in 45 CFR 75. Also pay special attention to section 7, which contains important contact information regarding the specific Nofo. So if while you're preparing your application, you have questions about specific requirements, these are the people to contact. HRSA identifies people to contact for every NOFO. Now I'm going to hand it over to Shonda, who's going to provide a bit more in-depth look at connecting these requirements to build a strong application. Shonda?
Thanks so much, Gwen. So when you're ready to write your application, you want to remember to connect all of the components of your NOFO. This is your time to tell your story. You'll want to be sure to connect the purpose in section 1 with the instructions in section 4 of the NOFO. Your narrative should just demonstrate a compelling need, a plan to address it, and the organizational capacity to carry out the project, all within the allowable budget. So let's dig a little deeper into the specific sections. Section 1 is entitled Purpose and Background. This is the program funding opportunity description. This section contains a description of the purpose, the goals, objectives, expectations, as well as the priorities of the program. This section also includes the background of the program, including the legislative authority. This section may also include key factors that led to the development of the program, indicators of successful projects, and examples of projects that have been funded in the past. Now, Gwen already went over sections 2 and 3, so I won't go further into those, but section 4 contains the application and submission information that Gwen did mention. Now, HRSA recommends that you supply an email address to grants.gov on the grant opportunity synopsis page and when accessing this NOFO, also known as the instructions on grants.gov or the workspace application package. This will allow grants.gov to email organizations in the event that HRSA changes or republishes the NOFO on grants.gov before its closing date. So responding to an earlier version of a modified notice when there is a revised version may result in a less competitive or ineligible application. So please note that you're ultimately responsible for reviewing the For Applicants page for all information relevant to the desired opportunity. Now, the narrative described in section 4 is the meat of your application. There may be 10 items listed for inclusion. Please pay close attention to this section to ensure that you provide a complete application which presents your organization in its best light for the review panel. The submission deadlines are also listed in section 4 of the announcement. It explains what is considered on time, as well as the consequences of missing a deadline. The letter of intent instructions and deadlines, if applicable, would also be included in this section. If intergovernmental review is required under Executive Order 12372, then this section will also explain how applicants can comply with that. Funding restrictions, which may be statutory, regulatory, or program specific, will also be included here. Finally, any other submission requirements, including grants.gov information, how to track an application, and any other relevant requirements would be included in section 4. So moving on to section 5, that contains the application review information, also very important. And that includes the review criteria. So those criteria will include the need, the response, the evaluative measures, the impact, as well as the resources and capabilities and the support requested. This section will also explain the review and selection process with a number of points that are assigned for each section, as Gwen mentioned, as well as the anticipated announcement and award dates. I'm going to skip over sections 6 and 7 as Gwen already discussed those, but section 8 is the other information. So for example, this section will include any pertinent definitions or any necessary web links for relevant programmatic information. The most important thing for applicants to remember is that your application be submitted complete and submitted before the deadline. Failure to include a piece of information that's required may result in your application being deemed unresponsive, and it may not be considered in the competition. So it's really important to read and understand the notice of funding opportunity. Now I'd like to show you a very important resource. The HRSA Application Guide. This can be found at hrsa.gov Grants Apply Application Guide. The application guide is a very useful tool and may answer many of your questions. This is HRSA's guide to help you submit a complete and successful application. We highly recommend utilizing this very important resource, which you will find referenced throughout whatever Nofo it is that you're looking at. Now let's move to the next slide where we'll begin to discuss the budget submission expectations. The first budget requirement you must submit with your application is the SF424A or the SF424 R&R, which will be identified for you in the Nofo. When completing these forms, please be sure to provide a one-year program-specific budget for each year of the project period. You should list a breakdown by object class categories. For example, the direct versus the indirect costs as applicable for each year on the columns provided. If your budget includes indirect costs, you will be expected to include a copy of your organization's current indirect cost rate agreement with your application. The second application budget submission requirement is the budget justification narrative, which is different. There's not a template or a form provided for the budget narrative. However, the budget narrative should include, be consistent with, and justify each of the line item categories requested on your SF424A or SF424 R&R. For example, budget narrative categories include a breakdown of each personnel listing their salaries, including fringe benefits per person and their requested FTE. It also includes travel, both local and long distance, a breakdown of all requested supplies with the cost per unit, a listing of any contractual costs, including the purpose of each contract, how the costs were estimated, and the specific contract deliverables. Equipment must also be listed, which is different from supplies. Equipment has a cost of $5,000 or more per unit and a useful life of more than 1 year. And finally, any other costs which did not fit into any of the other line items, as well as any requested indirect costs as applicable. So this program budget justification narrative should clearly explain how the costs for each line item were derived by delineating and providing cost calculations, and should specifically describe how each item will support the achievement of the proposed objectives in the Nofo to which you're applying. It's required that a budget narrative justification be submitted with the application for each year of the project. That's important to remember because a lot of people will submit, they'll see that, but they'll only submit 1 year of budget justification, and that doesn't always give the application a complete picture. There are a few other important things to remember pertaining to the budget submission. The Further Consolidated Appropriations Act 2020, Public Law 116-94, which was signed into law on December 20th of 2019, restricts the salary that may be paid to an individual under an HHS grant, cooperative agreement, or applicable contract to a rate no greater than Executive Level 2 of the Federal Executive Pay Scale. So effective January 3rd of 2021, the salary limitation for Executive Level 2 is $199,300. You will also want to pay important attention to any program-specific funding restrictions, which, if applicable, will be identified in the Nofo. Now let's move on to discuss how to write a strong application. Here we've summarized our best recommendations for submitting a strong and successful application. We call them the 5 R's. 1, do the research. 2, recruit a team. 3, respond to the guidance. 4, review the application. And 5, revise it as needed. R number 1, research. So what do we mean when we say do the research? Learn about the grant program. Study projects that have been awarded in the past and assess the specifics of the Nofo and how it relates to HHS's overall mission and goals. Consider your organization's capacity, for example, your staffing, your fiscal infrastructure, etc., and evaluate the time to cost benefit of applying for the funding opportunity. Do not ask yourself if your organization needs the funding, but rather whether your organization can commit to the potential project. R number 2, recruit a team if possible. Could you move to the next slide? Thank you. There's a lot of work to be done in preparing a grant application. Whether you use a grant writer, which by the way is not an allowable grant item, or a group at your agency, you'll need to pull together the various pieces. If you're a consortium member in a grant, talk about roles and expectations in advance. R number 3, Respond to the guidance. Next slide, please. Use clear and concise language that makes it easy to read and be organized and logical. Applications that fail to project a complete and thorough thought process run the risk of receiving low scores during the review process. Remember, completeness is key in thought as well as in submitting any required attachments. Stay focused on the project activities. Follow the instructions in the Nofo carefully. When you're submitting your application, you'll want to remember that all information should be placed in the order it was requested. A careful and ordered response is key because it allows an applicant ease of review before submission, and it eliminates the possibility of reviewers having to search for information or possibly overlook included information. Be careful in your use of attachments. Do not use attachments for information that is required in the narrative. Cross-reference tables and attachments to the appropriate section of the application. Upload required forms in the proper order. Avoid jargon and acronyms. Describe gaps in current services. Don't assume reviewers' knowledge of your program or area. Remember that reviewers cannot include outside information and are only allowed to score your application based on what is in your proposal. Application responses should speak to the program requirements. Assume nothing, and keep the review criteria in mind. Lastly, be sure to use current data sources and show evidence of fiscal stability and sound fiscal management. Review your internal fiscal operations. Cite past experiences where and when possible. You may want to consider where your organization will sit financially after the project is completed and what percentage of your annual operating revenue the potential award would be. Next, R number 4, review your application before you submit. Sometimes writers are not able to see their own errors. Have others in your organization review the application for clarity, accuracy, and compliance with the Nofo and application guidance before you submit. Determine if it is cost-effective to hire a grant writer. Utilize all available resources. And the last R number 5, revise. As one last step before submission, be sure to revise any last-minute changes as necessary. Ask yourself the following questions. Have I read the funding opportunity announcement, and is this application responsive to that announcement? Have I verified that my organization meets all outlined eligibility requirements, and have I included any documentation requested to support this? Does my organization have the technical expertise, the personnel, and the financial capacity to be successful? Are all stakeholders in my organization supportive and ready to accept this funding if offered? And finally, is my organization prepared to do what it takes to complete this project successfully? If you can answer yes to all of these, then you are ready to submit. Now let's take a moment to review the common mistakes made by grant applicants and remind you of some important tips for success. In addition to the grants.gov errors mentioned earlier in the presentation, such as the organization not being registered with grants.gov, the application submitted with the incorrect DUNS number or not having a DUNS number in time, or the organization having an expired SAM registration, there are a few other common mistakes, which include an application being rejected for errors, and yet the applicant did not leave enough time to correct those errors before the deadline. Sometimes there was enough time to correct, but the rejection email from grants.gov went to the applicant's spam folder and they didn't see it in time. The AOR, Authorized Organizational Representative, was not approved by the eBiz point of contact or was not available to submit the application when it was due, and there wasn't enough time to change the AOR. The applicant applied to the wrong announcement number, or the application exceeded the page limit. Keeping these common mistakes in mind will help you to avoid them. So let's dig a little more into that page limitation expectation. Depending on your program, this slide provides an example of pages that are considered mandatory for a research program and those which are optional. As you can see in this list, a subaward or subcontract line item budget form is not required, and the lobbying disclosure, while required in grants.gov, is not a required form in your application. If your program is not a research program, then you will likely submit an SF 424A budget and narrative, work and staffing plan, org chart, and key personnel documentation, which are all required, but would not need to submit the listed research forms. Your Nofo would outline all of this for you. Since you know there's a page limitation, be sure to count your pages before you submit. Be sure to review the Nofo requirements and don't leave out any of the mandatory forms. Regarding the optional forms, we suggest considering whether or not it is beneficial to include them based on your page count. Now, standard OMB approved forms, which you will often see referenced as SF with the associated number, such as what we've talked about, the SF 424A budget form, or the SF 424 R&R. These are forms which are included in the application package, but do not count in the page limitation. The IDC rate agreement and nonprofit status are other examples of potentially required inclusions, but which would not count in the page limit. However, you do need to count the abstract, the project and budget narratives, not to be confused with the budget forms, along with any other required attachments. So to emphasize this point, let's say that you include 5-page resumes for every key personnel, or you decide to include some colored graphs about your organization, which account for 5 pages because you think they'll be impressive or create emphasis for the reviewers. That's okay. Just be sure to make sure you count them in your total page limitation. And while submitted outside of your application and thus do not count towards your page limit, don't forget that your organization will need to complete the following certifications in grants.gov. For example, the drug-free workplace requirements, any lobbying disclosures, debarment, suspension, and other responsibility matters. You can find these forms online if you want to review them prior to applying. Now, here's an interesting fact. The grants.gov data analytics reports on their submissions versus closing date that approximately 27% of applications to HRSA competitions were submitted on the closing date, not before. Remember that early submissions allow you time to address the biggest submission problems that we discussed earlier. So where do you find Nofo help and assistance? Actually, let's pause here before we move to resources and support. Let's do a quick knowledge check to see how much we remember. Josh, could you pull up that next poll? Okay, so which of the following forms is not required? The SF 424A, the lobbying certification, the program narrative, or the budget narrative? And then question 2, which of the following does not count in the page limitation? The SF 424A, the work plan, the budget narrative, or the personnel documentation, which is the resumes or CVs? We're not keeping track of right or wrong answers. Okay, Josh, it looks like we have about half of the people chiming in, so we can go ahead and look at those results. All right, so it looks like you guys are paying really good attention, and I know that's a lot of information that I've gone over. And remember, your Nofo is going to clarify for you what is required and what counts in the page limitation count. So you're not going to have to remember every single thing that I said, but I do want to try to help you to understand some of these things. But you guys are right. The lobbying form is something that you're going to complete when you're submitting your grants.gov registration. It's one of those disclosures that you're going to complete, but it's not part of your application package and therefore not required. And then as far as the page limitation is concerned, you're correct. The standard forms, so anything with the SF, those are examples of things that are not counted. They are required, but not counted in your page limitation. So great. Now, in addition to submitting early and attending any program-specific technical assistance calls pertaining to the Nofo for which you're applying, we also recommend that you utilize any associated FAQs as well as any videos and podcasts on the program website. You may review the HRSA Grants Technical Assistance webpage, videos, and podcasts at the links that are provided on this page, which I believe Gwen is going to put in the chat for you. So it's HRSA.gov, grants apply, and then apply for a grant, prepare your application. And you may find grants.gov support, which was mentioned earlier, at www.grants.gov web grants support. Finally, a fantastic resource for you that you might not have considered. You may want to register to become a reviewer. Next slide. Becoming a reviewer is a great way to gain experience in the federal grant making process. If you work or have experience in healthcare, you may register to be a reviewer on HRSA's website at www.hrsa.gov grants reviewers. When selecting reviewers, HRSA looks for people with expertise in one of the following areas: health workforce training, HIV/AIDS, maternal and child health, organ transplantation, primary care for underserved people, and rural health. Being a HRSA reviewer provides experience in the federal grant-making process. In addition, reviewers are compensated, and most reviews are done remotely. So at this time, I'd like to turn things over to our partners at Open. I think we're going to take a short break, but when we return, we will discuss what you can expect.
Visual analytics. Anyone?
Thanks very much, Shonda. And it is 11 after, and we will return in 10 minutes.
Hi, everyone. Welcome back. I hope you all enjoyed your break. Thank you so much for hanging with us. I know sometimes at the end of the day, it feels long, but y'all have been such troopers throughout the duration of this meeting. And so I am so excited to welcome back HRSA to the stage to continue on with part 2 of the presentation. And as a friendly reminder, this is being recorded, and we look forward to hearing questions as well in the chat, and we'll be disseminating this presentation afterwards. Thank you. So back to you all.
Thanks so much, Brittany. Welcome back, everyone. I promise we're almost done. So we've talked about what you need to do to prepare to submit a federal application. We've talked about where you need to register, as well as how to find an applicable announcement in Nofo. We've helped you to put together a strong and organized application while avoiding all of the common mistakes. And now you've submitted it. Congratulations. So now let's talk about what happens next and what you can expect. Once your application is submitted, it goes through many levels of evaluation and review before a determination for funding is made. Once it clears grants.gov and before being sent to objective review, each competitive application is reviewed by the Program and Grants Office for completeness and eligibility. Here, applications are determined to be eligible or ineligible based on the requirements outlined in the Nofo. Basic checks are completed to ensure that the application submitted is complete and that it includes all of the required components of the particular funding announcement. Now it's ready to move on to objective review. Josh, could you please pull up our next poll? Great, thank you. So your application is about to be reviewed by the Objective Review Committee. Let's see if you remember how the reviewers are going to score your application. Will they base their score on your pictures, graphs, and presentation? Will they base it on how the application responds to the review criteria? Will they score based on the information that they know about your organization, or all of the above? Okay, in the essence of time, let's go ahead and close the poll and show the results. So I know that was a little bit tricky, and while the presentation is definitely important, don't forget that reviewers will score your application based on how the application responds to the review criteria. Once deemed eligible, applications move forward for review by an Objective Review Committee called the ORC, which is composed of grant reviewers who are subject matter experts in the subject areas being funded by the program. Reviewers must sign a conflict of interest form prior to participation in the review. Each application that is reviewed by the panel of experts is scored against the set of criteria provided in the application guidance and scored based solely on the information presented. Remember, they're not allowed to bring in outside information or make assumptions. And each application is scored independently, not in comparison to other applications. Additionally, the committee works together to prepare a compilation of comments, which we call the strengths and weaknesses for each application, along with any budget recommendations. The coordination and oversight for the review is provided by HRSA's Division of Independent Review. Program and grants management staff attend pre-review meetings to provide budget and policy clarification to reviewers. They also attend the objective review, but are only there to provide minimal assistance to reviewers as each application is reviewed by the experts on the panel. HRSA staff only step in to assist if reviewers are unclear on what is required in the Nofo or to answer inquiries from reviewers when help is requested. During the review, the reviewers' budget recommendations are captured to ensure they are included when awards are made also. So let's move on now to the awards. Now we enter the award phase of our grant cycle, where the program officials review the outcome of the objective review and identify program-specific terms and conditions for the awards. These terms and conditions are subsequently reviewed by the Grants Management Officer, called the GMO, and assigned to a Grants Management Specialist, called the GMS, to review and prepare individual awards. During this stage, there are frequent conversations between the GMS and GMO, and program is consulted on program-specific matters. Next slide. During the award phase, the Division of Grants Management Operations receives a funding memo from the program office listing the highest ranked applications and begins analyzing and executing the awards within HRSA's electronic handbooks. We call that our EHBs system. This is the electronic system where all information is housed within HRSA and where all post-award correspondence is submitted by grantees and responded to by HRSA. This is the system from which awards are issued. Now let's go into some of the details of how the awards are generated. Earlier, we discussed the financial assessment, which we call the FA, conducted at the organizational level. During the award phase, DGMO reviews that FA by reviewing the individual application, where we address budget concerns with a fine-tooth comb. The Grants Management Specialist reviews assigned applications for administrative requirements, considers the ORC reviewer's recommendations and/or comments, determines allowability of requested costs, and ensures consistency with the Nofo requirements. If the pending grant award is for a previously funded or ongoing award, we check to ensure that prior conditions are met, that the payment management system or the PMS system account is current, that the federal financial report called the FFR has been submitted, and that all reporting due in the EHBs is up to date. Any outstanding items may result in a request for additional information and could delay the ability to issue a timely award. Once everything is complete, an award is generated and sent to the applicant, which we now call the grantee. Now we'll look at a sample notice of award. I will explain how legislation is front and center. In October of 2020, HHS implemented a new look for page 1 of all notice of awards, or NOAs. As you will see, there are a number of very important pieces of information located on the first page of the NOA. The left side contains much of the recipient information, the name, EIN, DUNS, and the contact information for the project director or principal investigator, just to name a few. The right side has the grant number, the program legislation, which you may notice is identified by the red arrow, the assistance listing number, formerly referred to as the CFDA number, as well as the summary of financial information and the project period start and end dates. That takes us into the post-award and monitoring phase. As you can see, this phase is a shared responsibility with all parties. The grant recipients, the assigned GMS, the assigned PO, as well as the Division of Financial Integrity. Recipients are required to communicate to HRSA any responses to conditions and reporting requirements and any changes they propose to make in the approved program and/or budget. The GMS works with the PO to evaluate each submission and request. First, a recommendation is made on the course of action by either the PO or the GMS, depending on whether the action is programmatic or fiscal in nature. If the submission is incomplete, the recipient will be contacted and the submission will likely be returned for revision. Once the submission is determined complete and an agreement is made between the GMS and PO, then the GMS is responsible for rendering and communicating the final HRSA determination to the recipient via the EHBs. Program officials assess performance, while the GMSs assess spending and compliance. Both offices work in collaboration and are able to provide technical assistance to grantees as needed. In addition to the PO and GMS, DFI performs post-award monitoring to ensure recipient compliance with financial management requirements in the applicable regulations and with award terms and conditions. Some of DFI's post-award monitoring work includes resolution of findings in single audits, performing reviews in response to recipient financial concerns, and providing fiscal technical assistance to award recipients as needed. Proper fiscal management will be the next topic coming up in our presentation. Grantees must be sure to stay in compliance with not only the program goals and objectives and the plan they outlined in their application, but also to the federal requirements. Those requirements are referenced on the subsequent pages of the Notice of Grant Award and are often easy to overlook, but they're very important. Terms are policy and administrative requirements. Terms can be standard, grant-specific, program-specific, and may even include special restrictions for an individual grant, such as drawdown restriction. Conditions are legal requirements which require a response from the grant recipient by a specific date. For example, some grantees may be required to submit a revised budget within 30 days of receipt of their grant award, which may be in response to a reviewer comment captured during the objective review. All responses to condition or requests for prior approval, such as budget change requests, a change in program director, a request for carryover of unobligated balance, or even an extension to the project period or a change in scope. All of these are submitted via HRSA's EHBs and responded to by the program and grants offices with the revised notice of award when applicable. HRSA programs have requirements for both financial and performance reporting, such as the FFR and other data collection items. Basic information on these requirements will be listed in the Nofo. However, if awarded, detailed information for those requirements will be provided to you by your PO and GMS, as it is always HRSA's goal to provide excellent customer service. And speaking of customer service, I would now like to turn the presentation over to Marian, who wants to help you to keep your grant in compliance and to help you ensure that your organization has all proper systems in place so that you can not only complete a successful grant project, but also avoid any unwanted audit findings. Marian?
Thank you, Shonda. I'm Marian Montez, and I'm an auditor on the Financial Management Review Team, which is part of the Division of Financial Integrity. And today I would just like to discuss with you some proper fiscal management, which includes your ability to document, evaluate, and report. An organization's financial management system is their system of planning, organizing, directing, controlling all financial activities. So it would include your electronic systems, like if you have accounting and timekeeping software, but it is also, and most critically, your policies and your actual practices around managing your financial activity. For organizations that receive federal awards, there are very specific standards they have to follow and requirements they must meet in order to maintain a compliant financial management system. So when you're considering applying for a HRSA award, one of the first questions to ask yourself is whether your organization has the technical expertise, the personnel, and the financial capacities to successfully implement the type of project discussed in the Nofo. And a big part, of financial capacity that can be overlooked at this early stage is whether your current financial system meets these federal requirements, and if not, what steps you can take to get there. When you have a successful application and you receive a HRSA award, you need to have a compliant financial management system in place. So you need to consider this at the beginning. And having adequate financial systems and internal controls, especially in the management control areas, will also help you to maintain and be able to identify the level of information needed to draft an application budget that is meaningful and accurate, and it captures the cost of your proposed project, which is obviously critically important. So prepare early and hit the ground running. Slide, please. Okay, so here are the things a system must be able to do to be in compliance with 45 CFR 75, in particular section 302. Your system, which is all of your financial management activities, electronic, manual systems, and policies, must include the ability to identify in your accounts all federal awards received and expended. Basically, you'll have the ability You'll need to have the ability within your accounting system to create separate accounts or identifying codes for each federal award received and expended so that you can easily track and report on them. You must have the ability to provide accurate, current, complete financial results of each federal award. You must have the ability to provide records that adequately identify the source and application of funds for federally funded activities. This also includes source documentation like your timesheets and receipts, invoices, all the documents that support your expenditures. So a quick note here is that in the regulation, it outlines record retention periods, which are the number of years that you are required to keep certain types of documents related to the federal awards, including an expenditure support. So make sure your record retention policies are in alignment before you receive the federal award, because you definitely don't want to be in a position where you find out you have disposed of documents that you may need to keep. If you want to, your policies can have your organization keep documents longer than the required retention periods. They just can't be less time. 3 years is the minimum, but there are exceptions, so be sure to check the regulations. Your system must have the ability to maintain effective control over and accountability for all funds, property, and other assets. This may include property records, capturing the cost of the item, the source of the fund, and the location of the property. You must have the ability to provide for a comparison of expenditures with your budget amounts for each federal award, what you plan to spend against what you actually spent. A good practice would be to do this comparison at least monthly. Written procedures maintained and in place to implement the requirements of payment are necessary. They need to exist, they need to be current, and they need to align with your actual practices. So make sure you review your costs prior to drawing down HRSA funds. And finally, you must have written procedures maintained and in place to determine the allowability of costs. Only certain types of expenditures are allowed to be charged to the federal award. They must be related to the grant project and within the period of performance. Proper maintenance of your financial system and proper documentation of your program, activities, and records will help in preparation for your site or audit visit as well. Slide, please. The next section of the Uniform Administrative Requirements, section 45 CFR 75.303, talks about internal control requirements. Your organization must establish and maintain effective internal control over the federal award that provides reasonable assurance that you're managing the award in compliance with all statutes, regulations, and the terms and conditions of the federal award, and that you know what the risks are. Besides establishing and maintaining, you must be able to evaluate and monitor your compliance with the statutes, the regulations, and the terms and conditions. You must take prompt action when instances of noncompliance are identified, take reasonable measures to safeguard protected, personally identifiable information, and other sensitive information. Slide, please. HRSA recognizes they recognize that this is a very challenging area to verify compliance with. So we've created a financial management requirements for award recipients document to provide organizations with a guide to ensure that their existing policies included the necessary controls and that they were in compliance. It goes over 18 management control areas that must be fully addressed in a HRSA award recipient's policies and procedures. And as shown in the table here, it's everything from cash management to timekeeping, travel, annual audits, conflict of interest, indirect costs, and a variety of other areas, all boil down to brief sections listing what your policies and your procedures must address or require. When you're considering applying for a HRSA grant, you're trying to assess, your financial capacity, a great way to do this is to just take this document and compare it with your written policies. And if you don't have a written policy in one of these areas, or it doesn't address the required items listed in the guide, go ahead and update your policies to be in compliance. You also want to ensure that your actual practices match your compliant written policies. This can also help you identify what immediate steps you would need to take if you receive the award you're considering applying for. For example, would you now be subject to audit requirements that you haven't been in the past? Would you need to make new accounts in your accounting system for award funds that were awarded, received, and expended? Slide, please. So I mentioned resources throughout the past couple minutes, and as promised, here are a few good ones. There are a lot more tips and presentations around financial and grants management available on the HRSA website. But in the stage where you're preparing to receive a HRSA award, when you're considering applying and just taking those initial steps, I think these are especially helpful. These are the direct links to the resources that we'll discuss in a moment. You can also locate all of them on the HRSA website.gov. The Apply for Grant section listed under the Grants banner contains lots of valuable application tools. In addition, I've highlighted these few from the Manage Your Grant section that can also be useful in the application or the pre-application stage. We've also included the links in the chat box. So the first one, the Financial Management Requirements for Award Recipients document, is the one we just discussed on the last couple of slides. It's an 8-page document, and it just simply outlines briefly, clearly, what a HRSA recipient needs to have fully addressed in their policies and procedures in those 18 management control areas. And my favorite way to use it is just as a checklist to run through those 18 areas. And as I mentioned earlier, on just one hand, you have your written policy, on the other, you have this document, and you compare them. And it acts as a check with your actual procedure as well, when it's done by individuals in your organization responsible for each area. So if the policies aren't compliant or they don't align to what you've been doing and they need to be revised, those people should be able to update them as necessary because it's part of their normal daily tasks. The next link is a 1-page tip sheet, provides suggestions for developing effective internal controls. And it covers areas that you should consider, questions to pose internally about identifying, mitigating risks, and how to support and measure your success in developing and maintaining effective internal controls. And finally, here again is a link to Title 45, Part 75 of the Code of Federal Regulations, which outlines the uniform requirements, the cost principles, and audit requirements for HHS awards. And I think the best way to make yourself familiar with this is to just look in the regulations and focus on the topics that you're specifically interested in or you have questions on. For instance, we talked about the standards in the first part of the session. And if you'd like to see more detail about any of the requirements, you can read the full text in section 302. So seeing the detailed language of the pertinent regulation can just provide details when you're comparing your financial policies and you're trying to ensure that you understand and that you're meeting federal requirements. So look for all of these resources on our HRSA website. And that wraps up our section on financial system requirements. Thanks for sticking with me. I hope that gives you some useful insight and tools, making sure you're fully covered in this important area. And with that, I'll hand it back to Shonda.
Thanks so much, Marianne. So our grant life cycle is now almost complete. The end of the grant life cycle is closeout, which takes place after the expiration or termination of the project period. And in the closeout phase, grants management takes the lead role. The closeout process includes ensuring timely submission of all the required reports, the evaluation, and acceptance of the reports by HRSA. This is also when a reconciliation of any amounts due to either the federal agency or to the recipient are determined and payment arrangements are made. Next slide. The closeout reports are the last responsibility of the grantee. These are very important as they communicate all of the great work that was done during the grant program. However, failure to submit timely and accurate final reports in the closeout phase may affect an organization's future funding or awards with the same PD in a future application. So keep that in mind. Well, that brings us full circle. We hope you've enjoyed our presentation and better understand the parts of the grant life cycle and the basics of grant administration. We're confident that the important tools, recommendations, and reminders we've provided will prepare you to be a successful applicant for federal funding. And we look forward to working with you in the near future. These last two slides just give you a little bit of final information. If you would like to contact any of us after today's meeting, we've included our contact information here. And on the next slide, we'd also like to invite you to connect to HRSA on one or all of our 4 social media platforms. We encourage you to follow along and share our content on Twitter, Facebook, LinkedIn, and Instagram to stay up to date on the latest HRSA news. Our account or handle on each platform is @HRSA.gov. Additionally, we also encourage you to sign up for HRSA's e-news, a biweekly email of comprehensive HRSA news, and to sign up for HRSA press releases. You can also visit our website for more detailed information about all of our programs. So with the last couple of minutes, I don't know, I'll let Open tell us if they want us to respond to any questions now, or if you would like, we definitely will respond to those after the fact to be uploaded.
Shonda, Gwen, and Marian, that was amazing. Thank you so very much.